Let's read Nathaniel's blood pressure. But first of all, let's learn how to sit when your blood pressure is taken. Number 1, you must not have conversation. Number 2, put cuff on bare arm. Number 3, the level of arm is level of the heart. Number 4, you must have an empty bladder. Number 5, you must keep your leg uncrossed. And lastly, you must keep yourself relaxed. Today, we will be using a digital blood pressure device. After putting the cuff into patient arms, let's wait for the result for a few minutes. We must remember that the blood pressure of a person depends on the age and sex. Nathaniel is a 10-year-old child. The normal blood pressure of his age is 112/73. His systolic must range between 97 up to 112. His diastolic must range between 57 to 71. The reading of his blood pressure is 86/49. Maybe Nathaniel is not that relaxed today. Let's check Nathaniel's respiratory rate. In taking the respiratory rate, there is a lot of factors to be considered. First, let's determine if the breath is labor or unlabored. First is the labor breath. This is when a patient using their mouth to breathe. And then we have the unlabored breath. This is when a patient using their normal way to breathe. The next is the irregular breath. The breath is not consistent. Lastly, we have the regular breath. The breath is consistent. Nathaniel has a regular breath. Let's start by setting the timer into 30 seconds. The patient should not be aware that we are counting their respiratory rate because there is a tendency that they will alter their breathing. It is better to count the breath manually because usually the monitor is not consistent. 1 fall plus 1 rise is equivalent to 1 breath. Take note, if the rate is irregular, you have to count for 1 complete minute. Time's up. It's time to calculate. So, the normal breath of a 10-year-old boy is ranging between 18 to 30 breaths. After counting for 30 seconds, we got 13 breaths. So let's multiply it by 2. It is equals 26. So Nathaniel has a normal respiratory rate. Let's check Nathaniel's heart rate. First, let's set the timer into 15 seconds. I placed my 2 fingers between the bone and the tendon over his radial artery, which is located on the thumb side of his wrist. And time's up. Let's calculate. Nathaniel is a 10-year-old boy, so his normal beat per minute is 60 to 100 beats. The total count of Nathaniel's heartbeats for 15 seconds is 21. So, let's multiply it by 4 to calculate the beats per minute. So, it is equals 84. Nathaniel has a normal heart rate. Let's check Nathaniel's body temperature. We will be needing a digital thermometer and an alcohol swab to clean the digital thermometer. While cleaning the thermometer, let's talk about the 5 ways on how to take a body temperature. We have rectal taken from a child's bottom, oral taken under the mouth, axillary in the armpit, tympanic inside the ear, temporal artery in the forehead. But today, we will do the oral method. I asked Nathaniel to open his mouth and put the digital thermometer under his tongue. With Nathaniel's mouth closed, we will leave the thermometer in the place for about 1 minute until we hear the beep. The average normal body temperature taken orally is about 37 degrees Celsius or 98.6 degrees Fahrenheit. It usually rises during the day from a low of 36.5 degrees Celsius in the morning to a high of 37.5 degrees Celsius in the late afternoon. We must remember that each child has a normal temperature range that may be different from another child. And now, let's take a look at the result. It is 36.9. It's normal. Let's assess the pain rate of the new arrived patient. Let's go! Hello, my name is Janice. Can I know your name?
I'm Nathaniel Drew. Uy!
Can you tell me why are you in pain?
Oh, because I fell from a tree and I had this wound in my head.
Alright, can you tell me how much pain do you have now? Can you rate the pain on a scale between 0 to 10? 0 is no pain and 10 is severe pain.
Oh, that's difficult. I can't rate it. Sorry.
Okay, I'll explain it to you. One to 3 in the scale is mild pain.
It's more than that.
4 to 6 is moderate pain. That is a sort of pain that can notice but it doesn't stop your daily activities.
Ooh.
7 to 10 is severe pain.
I will rate it 7.
Okay, thank you for your cooperation. I will be back soon. Tell me if you need anything.
Okay. Thank you for watching.